right. Hello, everyone. Dr. Mankal here from Ottawa. And we're finally got together here to do this really extraordinary interview with Dr. Walter Salubro of Ontario. The topic here today is sciatica. Everything about sciatica. It affects thousands of Canadians every year for different reasons. There's different causes and different treatments for it depending on where sciatica is coming from. Painful condition that affects the lower back and down the leg. It affects people's quality of life from movement to sitting to sleeping. It even gets into your psyche. So I wanted to bring Dr. Walter on here to share his insights. He's been in practice for over 15 years in Vaughan, Ontario. Welcome, Dr. Walter.
Hey, Dr. Mankal. Thanks for inviting me, and I'm super excited to do this interview with you and this show.
Finally, that's awesome. Okay, Walter. So you're in Vaughan, Ontario. You've been in practice for how long?
20 years now. I just
20 years. Okay.
In my 20th year this past December.
Fantastic. So obviously, you, like myself, see a lot of cases with sciatica.
Definitely, yeah. It's literally on a weekly basis for sure.
So let's just start off by asking some of the basics in here. So first of all, what is sciatica?
Mm-hmm. That's a good question because I think a lot of people get it confused. A lot of people come to our office will say, they'll call the phone and say, I have sciatica, I need some help. And what they're describing is leg pain. So yes, sciatica, true sciatica is a leg pain, radiating type of pain. But most of the time when people say they have sciatica, that they self kind of diagnose, if you want to say that, they really didn't diagnose it properly. It's not always a true sciatica. But this whole conversation we're going to talk about is definitely sciatica. And also, I want to kind of expand on other types of leg pain as well. So true sciatica is when the sciatic nerve, which comes out from the gluteal area, the buttock area, gets compressed or pinched, mainly by the piriformis muscle or the soft tissue in that area. So that nerve itself, the sciatic nerve in the gluteal area, the buttocks, gets compressed, inflamed, and then because it's a big nerve, it can zap pain right down into the leg, into the foot. So that's what really true sciatica is. But when someone has like a sacral issue or a problem with their sacrum or their lower spine, there's irritation there, that can refer pain into the thigh. And that's not really sciatica. That's more like leg pain or leg referral pain.
Right. So what are some of the triggers that you found over the years? What triggers sciatica for people?
It can be a variety of things. In my experience, it's something that people tell me that just kind of came on, the symptom, which is kind of really common with a lot of conditions. That doesn't necessarily mean that there was no underlying could have caused it. So our lifestyle can trigger things and stresses on our spine and our pelvic area and cause tightness in muscles, like chronically sitting all the time. Maybe you're bending or moving a lot, sitting in the car. Like a lot of people commute, especially in the Toronto area, has one of the longest commutes to get to work, back and forth from home to work. So that kind of stuff. Sports, if there's sports that involve a lot of motion to the back and the pelvis. So these are things that typically build up. It doesn't just appear in my experience because of a traumatic situation that someone has sciatic or leg referral pain. Something that builds up over time. And that's why it needs to be investigated very thoroughly.
And you mentioned that some people may have an underlying condition that predisposes them.
Mm-hmm. That's right.
And not to get into a lot of the different spinal pathologies that can get into that, but let's give some viewers some good content here that they can use. Let's talk about what they can do. So is walking good for sciatica?
Well, normally when someone has sciatica, they're going to have a challenge walking. And they'll come in limping. They'll come in leaning away from their achy leg or the leg that's in pain. When you're putting pressure on that leg, because it's the ground reactive forces press back into your sacrum region and your muscle region and in the buttock area, everything's activating again, and it's causing a lot of irritation. So it can aggravate the condition. It doesn't mean that I don't want people to walk. I always tell people to try to keep mobile as much as possible and not just bed rest, because I don't think that's healthy anyways. But if you can keep mobile around the house and then rest when you have to, I think that's helpful. So I do recommend some kind of mobility and try to get mobile, but without aggravating the condition, if that makes any sense.
Right. I tend to find as well, if they sit for a while, then it starts to burn their legs. So they want to get up and move around so you got both ends of the spectrum, right? Some people, they got to get up and walk. It feels better when they're mobile. And some people, it hurts them to stay walking. It depends on where the nerve is being irritated. Would you agree?
Absolutely, 100%. Depends where the nerves are being irritated. Depends where the spinal joints and tissues are being irritated. And just some simple things. Let's say that someone has to stand at home or at work for whatever reason. and they have that right leg pain, well, they could put like a little step stool, maybe 4 inches high, on that right foot, and then just step on it, and that kind of releases the tension on the sciatic nerve.
Right.
So the sciatic nerve goes right from the gluteal area, the buttock area, right down through the thigh, and branches out into the leg, into the feet. So if you're extending the nerve, and if it's inflamed, it causes even more pain and discomfort. So when you bend the knee and you're resting the foot on a little step stool, you're now relaxing that sciatic nerve and just giving it some relief. So that really helps as well. When people are sitting, for instance, same thing. So if you're sitting at your desk and just aggravating your buttock area and the sciatic nerve area, get that step stool and place both your feet on the step stool, and that will help relieve that as well. So those are some tips to do for standing and sitting.
Something else I mentioned to also patients is in the kitchen when they're cooking and standing for a while, they could open up the cupboard and put their foot inside there. There's probably a little 3-4 inch shelf there that would also relieve some pressure.
I like that idea.
Dr. Walter, what do you think that one of the earliest signs of sciatica could be? Is it just directly right away leg pain?
That's a great question. And it usually isn't, in my experience, from what I've seen. It could be something like a low back twinge or low back ache or pain. It could be what a lot of people call quote unquote hip pain, but it's not necessarily true hip pain, because true hip pain will be right in the actual hip joint where the femur connects to your pelvis. But sometimes when people say hip pain, they're talking about the sacroiliac joint. So let me just kind of show you a model of what I'm talking about.
Right.
So I'll kind of back up a bit. So this is a pelvic model and a lumbar spine model from the back, and then this will be from the front, and then this is from the side. So here, this is the hip joint. So when people say I have hip pain, I ask them to point to it, and they don't usually point to the hip. If they do, then I know I need to investigate the hip joint. Yeah. A lot of times they're pointing at the backside, somewhere around the gluteal area, either here or here. So this is the sacrum, and this is the ilium. This is called the sacroiliac joint. And when it's irritated, it's super painful. And there can be a local inflammatory reaction there and local pain there. And sometimes that can be the initial start of progression into the leg, right? So it can start off as a low back inflammation and pain, a sacroiliac local inflammation and pain, and then it may begin to react into the muscles of the buttocks, like the gluteal muscles and the piriformis muscle, and it may even refer pain into the thigh. So that's not really true sciatica. And then when the sciatic nerve gets compressed, so the sciatic nerve essentially is made up of the nerves of the lower lumbar spine. So L4, L5, it's going to be hard to see. Let's see the sacral nerves on the inside, and then they come out of this area here through the piriformis muscle or under the piriformis muscle and then into the thigh. So when that piriformis muscle is compressed or tightened and it begins to compress in the sciatic nerve, then now it'll literally give nerve radiating pain into the leg, into the foot, which is excruciating and painful. A lot of people call it, name it by like shooting leg pain, for instance, as that's how they describe it. So it doesn't always appear instantly as either thigh pain or leg pain. It can start off with low back discomfort or even a sacroiliac pelvic discomfort.
Right. So people are sort of putting up with this or trying to deal with it when it's local and small. And one day all of a sudden it just, starts to become really inflamed, head down the leg. So the underlying issue may have been going on for maybe months to years before it really flares up on people.
For sure. Great. And that's one of the things I tell all my patients, even when I do my videos on YouTube or Facebook, is I think one of the biggest mistakes people do is they just wait too long to get checked. As soon as you have a signal or a pain symptom, that's your body's way of telling you that something's wrong. Don't wait, because if you tackle that and get that assessed and corrected early on, it does not become chronic. When it becomes chronic, the corrective procedures take longer to set in. The healing time takes longer, just like any other chronic ailment or disease. So as soon as there is an issue, get it checked and get it corrected. Chiropractic is one of the best ways to begin to work with the structures that can trigger leg pain and sciatica. So I highly recommend to get that checked as early as possible.
Exactly. A common question I get is when they get this burning pain in the hip and the bit into the leg is massage helpful, to get a massage in the area? What do you think of that?
That's a great question. And I like massage. I think massage is a great adjunctive therapy to chiropractic. It doesn't replace chiropractic corrections or adjustments, that's for sure. And, when I have a patient that comes in with acute back pain, pain in that gluteal buttock area, pain that shoots into their thigh, when I'm just assessing and pressing those tissues, they're jumping off the table already. So even though massage may be helpful for them, let's get the spine corrected and stabilized first. Yes, massage can be helpful, just it's the timing of when it's helpful. If you jump into massage therapy right now and start working out that piriformis muscle when it's inflamed, or the gluteal muscles when they're really tightened and contracted, or the low back paraspinal muscles that are trying to guard everything, it's not going to benefit them. It's going to be uncomfortable. They're going to maybe react even more and be more painful afterwards.
Yes.
If they just wait for several weeks, let the entire inflammatory process subside through either chiropractic and maybe some home remedies and therapies like ice and stretching and so forth, and then later on tackle the soft tissue component of the problem with massage in addition to chiropractic, that's how I would recommend it. And I've done that with a lot of my patients.
Yes.
And what they tell me too is they appreciate the fact that I'm actually telling them, they don't have to do everything right away. There's a certain protocol and a certain way that we handle things. You don't have to jump into everything all the way. So that's
Right.
key, I think.
I've been in practice for almost, I guess, 28 years now myself, Dr. Walter, and that's kind of what I found as well. Like getting massage right away may be irritating to the inflamed area. Yeah. So the things that we mentioned before to, start getting adjusted, stretches, ice, these kinds of things to reduce the inflammation. That's the process, and then we add things on down the road.
Yeah,
so I totally agree.
I'll share a little story about that. I had a patient that came in last October and had serious leg pain into the leg. Now, it wasn't a true sciatic leg pain. It was caused from a disc bulge compressing on a nerve in the lower back. And his whole gluteal buttock area was also irritated and compensating. And he went and got some massage. And he was actually doing well with us as in the early stages. Got a massage. They worked out the buttock area. And he couldn't walk for 2 or 3 days because of the irritation. Yeah. So, and it wasn't that it was intended to cause more injury. Sometimes there's aggravation with therapies. I get that. But the fact is that an RMT, as skilled as they are with their hands and soft tissues, will not understand the underlying spinal condition and component that perhaps a chiropractor can by looking at X-ray analysis, posture analysis, MRI studies, and compiling all that information together. So exactly. It's best that the communication is either passed on to the massage therapist, either through the patient, or maybe called RMT directly or massage therapist directly to kind of guide them along. I think that would be more suitable.
Oh, good recommendations there. What should people avoid if they have sciatica?
A great question. And things like bending and lifting would be a problem. So if you're bending all the way forward in a flexed position, you're going to basically stretch out that sciatic nerve and cause more irritation. When you're also lifting things, you're loading your lower back, your lumbar spine more, your discs more. And if there's nerves that are contributing to the sciatic leg pain, that will cause a problem as well. Bending, twisting, leaning to one side, be very cautious with these things. They should be normal physiological movements that we should be able to do. But when you're inflamed and irritated, either you're cautious or you avoid them. So, I would highly recommend those kind of things to avoid.
Fantastic. Along the line of the question, what about sleeping type postures? What do you think they should be doing? How should they, any postures during sleep you'd recommend?
Yeah, it's sometimes just hard to find the best position, no matter what you tell them. So some tips that I find that is really useful is if they use a couple of pillows to relieve tension on their legs and thighs. So if you're lying flat on your back on your bed, get 1 or 2 pillows, prop them up, and then bend your knees over the pillow. So it kind of releases the tension on the sciatic nerve. I find that to be very helpful, and so do patients. And if you're a side sleeper, then you get that pillow, 1 or 2 pillows, and put them between the knees. And then what that does is when you're sleeping on your side, so if you're on your side, the pelvis is compressing. So the pelvis is compressing like this, and this sacral area is compressing. That can irritate that whole area. So if you put pillows between your knees, it reduces the compression on the pelvis there and on those tissues and nerves that are irritated, and that can help as well. So those are 2 things I would recommend for sure.
You tend to find that in the morning, people get up after a night's rest that they're aggravated in the morning. Is that a common finding?
Absolutely, yeah, for sure. And that's common with low back pain patients generally. This patients for sure, that's very, disc injury patients is for sure common, and it can be also with sciatica. When you're sleeping at night, your spine's not mobile. Discs are getting rehydrated with water. There's no effects of gravity on the weight-bearing position from top to bottom of your spine. So your body's more in a relaxed position, even though it's uncomfortable throughout the night. Then you get up and you sit, and all that stiffness has to be loosened up. the tissues are kind of like they need to be warmed up again. You start moving and it's like, oh, this hurts all over again. You're adding weight bearing because of gravity when you're sitting or standing. So these things can aggravate that condition. So what I tell people is if that happens, before they get up, they can do some mobility work, maybe pelvic tilts while they're lying down on the bed, or they can sit down and do some mobility work with their spine and pelvis, some light stretching, and then they get up off the bed, and that will help in some cases.
Right. So that leads into my next question, which a lot of viewers would appreciate. What can they do to help relieve some of this discomfort? You've shared lots of different tips and strategies here, but is there like a sequence I'd like to take that give recommendations to patients of what they should do?
Get checked early. And what I mean by that is get checked by a chiropractor. Chiropractors, as you know, Dr. Mankal, we focus on assessing the spine and assessing the tissues associated with the spine. And as well, the spine sits on the sacrum and it's around the pelvis. So that needs to be assessed properly. You need to look at posture if that contributes to an underlying chronic problem that could have irritated those tissues over time. So when you start assessing this from a structural perspective and start to correct the structural problem that could be contributing to sciatic leg pain, then you're actually correcting the underlying problem versus just trying to patch it up. A lot of those home tips are good to get you by and really help. In most cases, they're not going to correct the problem. They're more like self-management tips that you can do at home to get you by when you're not at the chiropractic office or getting some type of therapy. So getting it checked, getting it corrected is super important. Finding out what the problem is causing it first and then getting it checked. So if someone has back pain and it's local, that's kind of a local problem. Still not good. But when it begins to travel down the leg, that's now a radiating or referral progression. So one of the goals of the care is when you're correcting around the spine and pelvis with chiropractic corrections and adjustments, we want to see the actual peripheralization, that progression into the leg. We want to see that minimize and decrease, and then the pain travel back up towards the local back area where it's coming from. That's called centralization. When that happens, the back pain actually tends to feel worse. Okay, that's the normal part of healing process. So we upfront our patients about that and let them know what to expect. And that's typically what we find with people when we're starting to correct the process. So getting corrected is important. And then the other part after things are corrected and stabilized is what I mean by stabilized is the functional and structures is corrected. Is you want to continue some kind of supportive care afterwards. Right? Either through chiropractic, massage is great for the soft tissue work, of course, and then any stretches and core work to help maintain good function over time.
Right. And it's hard to give specific directions maybe in this particular video because I think each case is unique and different.
Sure.
Some cases have a combination of a disc issue. Some people have a combination with a piriformis issue. Yeah. Some with the sacroiliac area and so forth. I even find some even the hip joint itself. That becomes a factor. Some have a foot issue that can also affect up in there. So they're very dynamics that can interfere just from the kinematic chain from the foot striking the ground all the way up into the sacrum and pelvis. So it's very hard to give you specific things that everyone should do because everyone's unique to their own history. I know when me growing up as a kid, I was hit by a car twice. So that created some structural issues that led me to more headache kind of patterns. But you know, being at the gym, that I'm pretty much I love fitness. I know you do, Walter, as well. I did realize that growing up, when I did get my spine X-rayed in chiropractic school, I actually had something called a spondylo. Right, so I have a grade 1 spondylo, and not to get into the details with the viewers here, but that kind of gives me a bit of a risk factor depending on what I do, that I can irritate that sciatic nerve in there. And now I get taken care of as well. I get adjusted, I do stretches, and I have to really modify my movement because, again, it's not something that can be totally corrected in my point of view. So just giving the viewers a perspective where there's some people have an underlying issue that maybe cannot be fully corrected, even a scoliotic deformity, for example, depending on your age. So there are things that are supportive, some that are structurally correctable, but some things that you're going to have to be able to manage to help yourself throughout your life. So I think this has been a fantastic interview, Walter. I want to thank you for your time and efforts in sharing your knowledge with the viewers here. So I'm hoping that you guys have learned something here today with Dr. Walter, and I want to thank him again. I'll be posting this onto our YouTube and social media outlets. And so again, if you find it helpful, please share it with other people who you felt are suffering and need some direction to it, because living life in pain is not so fun. So we appreciate you guys sharing your knowledge, what you viewed here today. So that's all I have for today, Walt. Do you want to add any final thoughts?
No, that was awesome. Thank you again for inviting me on your interview show. Congrats, you did amazing. I loved it.
Thanks, my first one.
In the future, yeah. Way to go.
Okay, that was awesome. Thanks again, and we'll catch you guys on the next interview or any other topics that we'll share. So bye for now, and have a great day.